what's up? It's Vince Leo from vinceleo.com, and in today's video, we're going to be talking about how insurance companies are joining forces with data collection companies to collect information on you and how that can increase your healthcare costs. Now, if you're new here to the channel, I do a lot of videos on health and plant-based nutrition, including recipes, taste test videos, healthy hacks, and more. So make sure you subscribe to the channel and ring that bell so you don't miss a thing. Now, even though this video is about healthcare, it still has to do with the food we eat and how active we are. And as you will soon see, how those decisions may affect your healthcare costs. Now, you see a lot of smaller news networks discussing this topic, but it hasn't really hit mainstream media, and you don't really hear many people even talking about it. Now, many people believe that this information is covered under HIPAA, which is the Health Insurance Portability and Accountability Act, and it does protect your medical information. However, HIPAA only protects your actual medical records, and the information that these data collection companies are collecting is information that's considered in the public domain, and it's not protected. And there are no laws or regulations in place to determine how health insurance companies can actually use this information. So what information do these health insurance companies actually have on you? Well, they have information on your age, your race, your education, where you live, what you watch on TV, what you post on social media, your purchasing habits, and even if you pay your bills on time. So if you have a gym membership and you go, they're gonna know about it. However, if you go to McDonald's every day, they're also gonna know about that. And all this information does seem kind of invasive, especially since none of us are really aware that this data is being collected and how it's eventually going to be used. So these data collection companies are basically gathering all this information, and then they're running it through a computer with different algorithms until they see different trends forming. And once they see these different trends, they basically place them into groups. So once they receive all the information on you, they basically run your information through that computer, through the algorithm, to figure out which group that you belong to. Now, these groups are supposed to determine what your future healthcare costs will be and what you're gonna actually need. So let's go over just a few examples of how insurance companies may determine what your healthcare costs will be in the future. So scenario number one, the algorithm may determine that if you recently purchased plus size clothing, that you may suffer from depression in the future and in need of mental health care coverage, thus increasing your healthcare premium. Scenario number two, if you're female and you recently changed your last name, the computers may determine either one of two things. One, you were recently married and may become pregnant in the future, or two, you were recently divorced and you may suffer from depression. Now, either one of these is going to result in higher healthcare costs and higher premiums for you. Scenario number three. Now, if you're a minority and living in a low-income neighborhood, the algorithm may determine that you live in a dangerous area and that you're going to be in need of additional medical care in the future, thus resulting in higher premiums to you. Now, it seems pretty obvious that there's no way to determine what's going to happen to a particular person in the future and what their healthcare costs will be. However, that's exactly what this computer, the algorithm, and what these data collection companies are trying to determine. And currently, there's nothing in place to hold anyone accountable for incorrect assumptions. Now, the spin these data collection companies are using is that the information collected is being used to determine what type of healthcare coverage a certain group of people will need. However, you can easily see how this information can be used to set price in the future. And I think everyone has the right to be a little skeptical about how this information is going to be used moving forward. So here's my take on this. While I can appreciate the fact that somebody can be rewarded for eating healthier and making better decisions about their lifestyle, I do think there's some major flaws in the system that do make this unfair. So going back to that example I mentioned earlier, if somebody is a minority and they grow up in a low-income neighborhood, but they're perfectly healthy, should they still be required to pay more for health insurance because of situations that may be out of their control? Also, it seems that this whole process is assuming that everybody has access to the same thing, which just isn't the case today. Take, for example, somebody living in a food desert. They're going to be limited to how many healthier options they have available to them compared to somebody who isn't living in a food desert. Now, we all have to decide what food we're going to eat and deal with those health consequences as they come. However, is it fair to penalize a group of people that don't have access to healthier food options just because of where they live? So this topic really interested me, so let's continue the conversation in the comments below. Let me know your thoughts and opinions about this whole topic. Do you think it's right that insurance companies have access to all this information to determine what your healthcare costs will be? What other issues do you see with computers and algorithms determining what those healthcare costs will be? So I hope you enjoyed this video. If you liked it, give it a big thumbs up. Subscribe to the channel as I post new videos every week. And join the Fit From Food notification squad by clicking on that bell next to the subscribe button. And remember to keep living fit from food. And I'll talk to you soon. Bye.